Well, when I was younger, I went through a lot with my biological mom when she basically abandoned me and left me, and like she gave me away to somebody for drugs. And I was found by my grandma, but I was put into CPS for a couple of years and then given in custody to my grandma. And then from my grandma, I went with my mom, then I went now. I've been going through a lot. Like, I can't forgive my mom. It's hard to forgive her. And I know that it's a bad addiction that she's going through. I want to forgive her, but it's hard because I don't want to say I forgive her or sorry when I don't mean it. Sometimes it does, like when I want to do stuff, I can't because I be so depressed. Like when I want to go out with my friends and have fun, I can't. And half of my friends I kind of treat very bad because of how I was treated, and I be feeling bad. But I know that I have to work on myself before I could move forward, because I was going to school, but I stopped going because I was going through a lot, and I got mental hygiene arrested and was there for like 3 months. I don't have Medicaid either, because every time when it comes to renew it, they say that my biological dad, which I never met, I'm under his insurance, but I never get it. Every year I go through a whole struggle, so I just didn't do it this year. They be wanting a statement from him, but I tell them every year, how could I give you a statement if I don't know him? Well, I'm supposed to go to the doctor every month for asthma treatment, but it's hard to when I don't have any insurance and it be so expensive. And I know when I go to my doctor, I ask them like, is y'all gonna bill me later? But they make me pay up front, so it's like a lot of appointments I missed lately because they won't do a payment arrangement plan with me. And that's another reason why I've been going through a lot as well, because like when I need to talk to somebody, I can't go to my doctor for help, for them to put me through a therapist because no insurance. And it's a lot of money paying out my pocket. Just for asthma treatment, it's $300 just to go for an appointment, and to put a down payment, it would be $150. And then they bill the rest, but because I haven't made previous payments, they don't make a payment arrangement with me no more. So it do be hard to buy groceries and hygiene. Sometimes my mom have to buy it for me, and then I have to tell her I will pay her, but never do. I really don't think people should have to go through all that just for Medicaid or insurance, because what happened when somebody really, really sick and they don't want to see, because that happened to me when I had pneumonia. They didn't even want to see me. I had to go to the emergency. I couldn't even go to my primary care doctor, and emergency could only do so much when they're not your primary care doctor. And it's like my doctor really don't care. I really don't even like the doctor I go to because it's like he has no heart.
It really began in 2005. I had got shot in the eye. And at that time, I didn't have any insurance. I was taken to Strong Hospital where the eye was removed, and they rushed me out. They rushed me out of the hospital because I didn't have insurance. And I was homeless at the time. Now I'm still got drains from my eye. It was still draining, but they said, you gotta go. And being homeless and this just being wounded, I said, well, where am I going? I'm not equipped for this. And they said, well, we got a homeless bus, and we're sending you to a homeless bus. As I began to heal, sort of, I started hearing things. And in my starting to hear things, I'm like, what's going on? So I got connected to the, how can I say, healthcare industry, like this. And the ride hasn't been very pleasant. I was scheduled to counselors, this, that, and the other, given all kinds of medication that has been, nothing has worked. I've gotten worse. I've tried to deal with it through street drugs and this and that. They tell me you can't do the street drugs. I'm saying, why? This stuff ain't working. This stuff you're giving me is not working. Since 2005 until now, I've been on. They gave me Thorazine for a fact, and I'm like, Thorazine had me, my body, I couldn't move. But I still hearing stuff. I'm like, you're affecting the wrong thing here, guys. I even asked a psychiatrist, I said, what do you do with people coming from Iran and all these wars they got fighting, and they come up with symptoms like mine. And I said, and I just seen an article, the suicide rate among veterans, astronomical. I said, what are you doing with these guys that you can't do with me? She said, we do the same thing, Hubert. I said, what does that mean, same thing? We just juggle medications until we find one that works with them. And she said, listen, Hubert, we're not being very successful with them either. But the price of these medications were no joke. And sometimes I could never afford a copay, so I have to go to the churches or somebody to help me with this stuff, because I still didn't have any insurance. So somebody always had to finagle the books. And you always think, because of my lack of wealth, that maybe I'm not getting the care that I'm supposed to. And I would look at the others in these rooms, and I would say, we're all poor in here.
Vast public investments in building the suburbs of America. Federally supported loans, FHA loans, went to people who were moving to the suburbs, and for many years, up until the 60s, those loans were available on a racially restricted basis. African Americans and other people of color didn't have access to them.
Until 1962, out of $120 billion in government-backed home loans, less than 2% went to non-white households. In Northern California, between the war and 1960, of 350,000 federally guaranteed new home loans, less than 100 went to black families. In cities like Richmond, African Americans were left behind in increasingly neglected neighborhoods. In the 1980s, poor Latino and Southeast Asian immigrants began joining them in these same neighborhoods.
Once the community starts to go downhill, nobody wants to actually invest in the community, so the banks don't want to come in and the shops don't want to come in. Then you don't have a commercial base, you don't have the community taxes that can then feed back into the schools. Now you don't have good schools, so families don't want to move into the community if they don't have to because you don't have good schools, and you get a sort of vicious cycle of everybody who can will leave the community.
This isn't something that happens overnight, and it isn't the fault of the people who live there. The people who live in low-income, disinvested communities did not do this to themselves.
20 years before his heart attack, Kwai tried to move his family out of Richmond, but 11 months later, they had to move back.
I can't find my job up there, and she can't find her job up there. And move back, my older son, hang around with the wrong group and then use some kind of drug. I just don't know what to do. I try to help him. I try to straighten him out. Spend a lot of money, owe people a lot of money. That's what in my mind all the time. So it's worry, just worry. When I'm going to pay up all of this, and how I'm going to do it.
If you think about when you're worried, you're always a little bit more activated. There's a little bit more vigilance. You're sort of checking things out a little bit more carefully. And if you can imagine that happening day after day, all day, every day, it's exhausting. And it wears on the body system.
When stress is chronic, when we're endlessly worried about our bills, our job, our children's safety, the body pumps out cortisol and adrenaline. But too much of these stress hormones over time can increase arterial plaque, raise blood pressure, and weaken our immune system, increasing our risk for almost every chronic disease, including heart disease, the leading killer in America.
We've done studies that have shown that living in disadvantaged neighborhoods is related to an increased risk. It's about 50 to 80% increase in risk of developing heart disease.
It's been extremely hard. It hasn't been hard due to barriers that I caused myself. It's hard for not knowing how the health system works and how it works towards people of my skin color, because to me the experience is very different for a man like me to walk in with no insurance and to seek help from a hospital and to be denied versus an opposite of my skin complexion goes to a hospital seeking help and then they get the help that they need. And then not having knowledge of what the healthcare system has to offer, not being taught that in school and having to grow up and kind of learn these things on your own is very difficult. So in a way, it will cause a wall of not knowing. I just found out 2 years ago due to an injury, I didn't know that an ambulance ride, you had to pay for that. And I think it's pretty crazy that if someone's life is in danger due to an injury, they would have to pay X amount just to get a ride to the hospital when that ride could have determined whether you lived or died. And then just because you have no insurance, you should not be denied the help that you need right during that moment. And like 8 times out of 10, the ambulances are late when they come to calls in the hood. Transportation can be an issue to people regarding on the location of their appointments or the location of their doctor. For somebody that lives on the whole other opposite side of town, transportation can be difficult regarding the fact that if you don't have a car, you have to catch the bus. And a lot of people can be very aggravated by the whole busing environment. Some people get Medicabs, but if you're not eligible for that, that's out of the picture.
Have you had any challenges personally?
Actually, yes, I have. I had an appointment. I had to make it to 9:30, and I think there was a delay at the bus because I didn't have a ride during the time. So when I got on the RTS, there was something wrong with one of the shuttles or whatnot. So I ended up showing up an hour late.
I know people who it has been an issue, and nowadays they do have the medical motors that I don't know how that works. I had never had to use it, but somebody was telling me I actually was in the hospital the other day for high blood pressure. And somebody was asking me if I had a ride home. First I said, yeah, then I said no. They said, don't worry about it because you can call the medical motors that come get you and take you home because of your medical condition. I was like, that's a good thing, but I already called somebody to come get me. So they do have ways. My mother, she's in and out of the hospital, so they have medical transportation for them. So they have buses though too. I hate to send somebody to bus, but they have transportation to get you there if you need to be there. As I got released from prison, I had no health care. So it was a while since I came home. I had a job 2 weeks after I came home, so that wasn't a problem. The problem was the amount of money I was making wasn't enough to pay for health care, eat, and survive. So I had to pool my resources and gather the information, do the footwork, so to speak, to get it. And I got health care now. It's Obamacare, but I do have it. There's a lot of stuff that you, as a man, that you don't want to do as far as working for somebody for $8, so to speak, And that was hard in itself, just to accept a position like that. But being that I was just released in the community, and only thing I held was an associate's, and that's arts and science, so I really had no major in it. So my education wasn't helping me none. It was basically all about the money, and $8 is not enough to survive. Being that I was a felon and just released and no immediate work-related history, that's in itself was hard. So, and I'm gonna tell you this right now, it's not about what you know, it's about who you know. Helps you out a lot in these days. Actually, I felt good when I got over there and sat down and talked to St. Joseph, and they were willing to, because I got mental health help, I was able to talk to a counselor. Let's just call him a counselor for now. So talked to them. I was able to get a full physical check for STDs, my HIV test. All this is for, they have a initial payment when you get there, $10. And that's all you paying for all that work. So St. Joseph is a big part of this community, and I appreciate them. Violence in this city right now is at an all-time high. And it's stressful because leaving out your door with any one of your family members, kids, whatever, it doesn't care. They don't care anymore. So you don't know if you leaving out your door to ever come home again. My take on violence in the city is, if they can't get it under control, we're gonna be it's gonna be a baby Vietnam here, Iraq or something. We killing each other though.
I'm disappointed in the youth, the way their mentality is out here, but not just because of them. I'm disappointed also for the people that are supposed to be in charge of maintaining our youth. Because for all this violence to be happening, to me, that's like an outcry to the community that, yo, something is wrong with us. Because for someone to take up arms and to kill somebody out of cold blood, that right there shows mental disturbance to me. For a person to have no regard for human life and just to kill cold blood like that, there's clearly something wrong there.
I think the health care is somewhat fraudulent. I don't think it serves the poor community. And when I say poor community, I mean racial lines don't count. If you don't got it, you're not going to get the quality that you need. You're going to get the pretense of quality. We're doing everything we can. It's something that needs fixing. It's too expensive, and a lot of us are being left out. I think we really need to come up with some plan where the rich and the poor get treated equally with health care. Right now, when I hear these candidates speaking, I hear nothing. I hear the middle class, but there's a lot of us who don't fit that status.
My personal beef with the health care is too expensive.
I think the solution should be nobody should have to go through all of that. Like, it should just be a one-step thing. You walk in, fill out papers, you got your card, like you got your Medicaid card, insurance card. They make you go through so much.
Working for $8 an hour, you cannot afford no $1,000 ambulance fee, because that's what they charge me. I would actually go to work sick. I would call around, and it's not good because it's you never know what happens. But if I was to get sick and I know it was wrong with me, I would call my friends to see if anybody had the prescription. I mean, it's illegal, whatever, but this is what you got to do to survive. It's sad. I couldn't afford to go and pay $100-something for 30 pills because I'm sick. So if I know what the pill is, I know what I need, and I know somebody that was sick, like I was sick or whatever, and they had them, I would ask for them, and they would give them to me. So it's one hand washes the other. You scratch my back, I scratch yours. I have no problem with that. We shouldn't be in that situation, being as a community as a whole, but that's where we at. And I just plead with the community to come together.